All right, good afternoon, everybody. Here with Paul and Josh and Brian Hurlbut and Deirdre Gifford, because we're going to be talking a little bit about supply chains and food. One of the reasons we wanted to make this a priority for today is I just got the briefing on the number of calls coming into 211, which is our information line of just about everything. And I got to say, food seemed to be question number 1, 2, and 3. It's food insecurity, be they farms, be they restaurants, or just folks trying to get a meal. And as you remember, Susan Beiswitz and I were at Rentschler Field just last week, and I remember these were all folks lined up for 2 hours, ready to get some food from folks there. And these are all folks who had a really good job just 6 weeks ago. So it's incredibly important. Just to give a little overview of what else we're going to be doing this week. Tomorrow we're going to talk a little more about contact tracing and testing, just because that is all part of our reopening strategy and so important to being able to isolate anybody who has been infected and who they were in contact with. Later in the week, then we're going to have our Reopen Connecticut team, Indra and the good doctor. And there we're going to start laying out a strategy between now and May 20th and then after May 20th and what we can open on a very methodical basis. And then finally on Friday, we've got our end of the month numbers that show you where we are for the end of this fiscal year, which ends June 30, and then the next fiscal year. And to be blunt, while the numbers are not very pretty, we look pretty good compared to a lot of our peers. So we'll go into that in some detail with Melissa McCaw. Just a couple of things that came to mind as I keep looking over at Asia to see what the heck's going on, what we can expect. It's sort of the tale of two cities over there. You've got places like Hong Kong and Singapore where they have a small resurgence going on again. And we wanted to make sure that does not happen here in Connecticut. But one of the reasons is Hong Kong has a lot of flights going in and out. Singapore has migrant labor in and out. So it just reminds you over in this part of the world, to the degree to which we can slow up a lot of travel, it'll make a difference for the long term. And the good news is over in New Zealand and Australia, where if you saw, they are slowly, through strict social distancing, bringing the infection rate to 0. So there is a light at the end of the tunnel if we focus on what we've got to do and what we've got to do appropriately. The supply chain, I just got off the phone with all our fellow governors and the White House task force. As I implied, it's sort of interesting what's going on in different parts of the country. Talking about supply chain, remember back in the 70s when we realized we were terribly dependent upon oil, mainly Middle East oil and OPEC, and what that meant in terms of those long lines at the gas station. And we've worked on our energy independence now, 40 years later. We're much better off than we were before. But it was just interesting hearing from some states like North Dakota and Wyoming, for example, where they have very low COVID infection-related rates, but they get half their budget from taxes on gas, taxes on natural gas and coal. And there, they've seen their revenues disappear by 30, 40%. So it's worth remembering how this pandemic affects different states in different ways. Speaking of, again, the supply chain, I think we have learned as a country how important control over our own destiny was, just like OPEC reminded us how important it was for energy independence back during the 1970s. I mean, we've obviously found out the hard way when it comes to protective gear, when it comes to gowns, when it comes to masks. Josh and I spent a lot of time, waiting for the plane to land from China. And we realize that going forward, this is something in our supply chain we want to get more control over. Antibiotics are the same way. I mean, most of the antibiotics come from overseas, generally ingredients that come from China, often processed, the antibiotics in India. And India put a hold on, exporting antibiotics for a while because they had their own pandemic. Again, when you think of PPE, you think of antibiotics, these are things in our supply chain that we'd like to get control over ourselves. And that brings us to food. And probably remember from the last couple weeks the tragedy of all those cars lined up at Rentschler Field, desperate to get just a few days worth of groceries. At the same time, you saw farmers around the country, getting rid of milk, and about what's going on in our poultry and our chicken and our meat processing plants. Tyson Foods just did an ad today, you maybe saw it in some of the big newspapers, saying, watch out, we could have some interruptions in our food supply. So with that in mind, over the last week or so, we've been meeting with talking with Brian and Deirdre about how we can get control over our own food supply. And I know we don't make most of what we eat here in the state, but let's do a better job of aggregating what we can and keep that food supply going so we don't have any farmers or dairy pouring milk away while people are lined up. And that's what Brian Herbert's going to be doing for us. As you know, Brian, he's our Commissioner of Agriculture, does an extraordinary job there, very close with the farmers. And so it's in that capacity that I thought he was the ideal person to help lead our effort when it comes to consolidating our food supply chain from the farmers, be it dairy and then produce over time, right down to food share and food bank and the people who are getting that distributed. And then Deirdre will talk a little bit more on the other side of the equation, because we have SNAP, which is the food support program we get from the federal government, in ways perhaps we can use the restaurants as part of our distribution system to get prepared meals to seniors who really won't be able to leave their homes for a while, at least not be able to do it as safely as we'd want. So, Brian, what are your thoughts about how we can shore up our food supply chain here in the state of Connecticut, and what that means for folks who are looking forward to being counted on a meal?
Thank you, Governor, and thank you for the opportunity to participate in this. It's not necessarily the normal role of the Commissioner of Agriculture, but it's one that I welcome. For those of you who are familiar with me and my background, I did work at Wholesome Wave as a senior VP for a while, and working on food insecurity and access to food issues. So Deirdre and I have been talking about this, about how we can do this. We've really put it into 4 separate buckets about where we can support the access to food. The first is food insecurity. First, I'd like to acknowledge and thank the employees and the volunteers that have led the food share and Connecticut Food Bank distribution efforts. I also was at the regional market a couple of weeks ago with the Lieutenant Governor and seeing firsthand how many families were in need, but also how many families have stepped up to volunteer their time for food distribution. So we've been able to increase SNAP allotments, SNAP eligibility, and the duration that families can stay on SNAP. Also, on the food system side, how can we make sure that our agricultural and food service industries are providing for those in need, and so we can tie those efforts into the recovery seamlessly and make sure that that families have the access that they need. That we're giving outlets for farmers and for restaurants to continue to contribute to our economy. We're doing that through increasing access to aggregation. We're doing that through increasing SNAP access at farmers markets and farm stands. Finally, food distribution, or not finally, but food distribution. We also need to acknowledge that it's not only people who are food insecure that are going to have challenges accessing food during all of this, but it's also folks that are quarantined or self-isolating. And so that becomes very important, that we have ways to get food to them. And then also food availability. How can we make sure that we work with our grocery partners, that everybody continues to have access to food? So those are the 4 buckets that we are looking to align together with a lot of the current efforts that have been going on to make sure that we're doing this in complete conjunction and collaboration across agencies, partner organizations, and outside groups. And Deirdre is going to speak a little bit about some of the efforts that have already happened that will make food more available for families in need in Connecticut.
Thank you. Thank you, Governor, and thank you, Commissioner Hurlburt. I'm happy to have the opportunity to speak to you this afternoon about some of the things that we're doing at the Department of Social Services to address the food issues that the Governor and the Commissioner have talked about. I want to start by acknowledging that we understand that this is a difficult time for many families because of the impacts of the pandemic, and that food insecurity is a problem, and in some cases, a problem for the first time for many families. And so we wanted to share with you some of the things that the Department of Social Services has been able to do, and then answer your questions. As the governor mentioned, we're privileged to be able to operate the Supplemental Nutrition Assistance Program, the SNAP program for families at DSS. Prior to the pandemic, we were serving about 350,000 individuals on that program. And we've done a number of things to make it easier to get and keep SNAP, and also to get more benefits to the people that are receiving SNAP already and expand. So we were very excited that on Friday the governor was able to announce that Connecticut has been approved for our so-called pandemic EBT program, PEBT. That's a program that was authorized by Congress and signed into law that will provide a new benefit to the families of 270,000 Connecticut children who live in towns that serve a large number of free and reduced price lunches. So families will not need to apply for this new benefit. We are working to get those cards generated and mailed out to families, and we thank the Connecticut Department of Education for their partnership in this program, and that will get about $72 million in SNAP benefits to these families. In addition to that, we've been able to receive waivers to make sure that everybody who is receiving SNAP already is getting the maximum amount. So we've announced in the past that in April, we were able to put $30 million additional dollars onto families' SNAP cards. And I'm happy to say that we've also received approval to add another increased allotment in the month of May. So another $15 million will go onto the EBT cards for families in the month of May. We've also extended SNAP eligibility. So if you were a recipient that was due to renew your benefit in April, May, or June, you won't have to worry about doing that. Your benefits have been automatically extended for 6 months well into the fall. We've reduced the number of people who need to have an interview in order to receive their SNAP benefit. So that's making it much quicker for a lot of people to apply, and we're happy to be able to do that. And we've also been able to eliminate some of the work requirements that were previously part of the SNAP program to make it easier for people to keep their benefit. And finally, something that DSS has received a lot of questions about, just to let you know that we are planning for online access to food with SNAP benefits. That has been something that wasn't previously available to Connecticut families, but we're working with our partners at the USDA to be able to allow families with an EBT card to purchase food online and have it delivered or picked up. So look for more details on that later in May. And finally, I just wanted to mention that, as Commissioner Hurlbert mentioned, we are talking about working with FEMA for somewhat longer term plans to be able to supply food to people who need to be at home during this pandemic, whether that's because they're elderly and at higher risk for infection, or because they're isolated or quarantined because they themselves are ill or have been exposed. And one of the things that we've been talking about is how can we get food delivered to those people. We're working on plans in conjunction with our partners at FEMA on how we can potentially engage our restaurant industry in getting meals prepared and delivered. We're not able to purchase prepared food with SNAP benefits, so this will be a new process that we're working on that we hope will both assist our restaurant industry and address some of the food needs of people who are at home.
Yeah, well, thank you, Deirdre and Brian. I mean, it's amazing what you're doing, not only feeding folks who are hungry and suddenly realized how insecure they were, but also doing what you can to help our farmers and doing what you can to help our restaurants. And before we take questions, let me just give you a quick update on where we are over the last few days, and in particular today. The COVID summary, I think of particular interest is the hospitalizations is down, and it's down again, and that's net hospitalizations, meaning the more people being discharged than are being admitted. Sadly, the fatality rate is still high. The next chart is sort of reflects where you are again. Again, you'll see that Fairfield is down. You'll see that New Haven is flat, and you'll see that Hartford is flat. So that's where you're finding lower hospitalization rate, more capacity, which gives us a lot more room. And I always care about admissions because a lot of these hospitalization numbers sort of reflect not just how many people are going in, but how many are going out. And yet new hospitalization sort of reflects perhaps more what's going on out there. And while there were 162 new admissions to our hospitals yesterday, that's down quite a bit, about 25% over the last day. Those numbers are lumpy, Josh reminds me, but hopefully there's a trend going on there. That next chart is really key because this just gives you an idea of what the 3-day moving average is. And this is really important because, as you know, the White House task force has said 14 days of declining hospitalization is an indicator that you're able to move into a space where perhaps you can start thinking about opening some things up on a limited basis. 28 days gives you a lot more flexibility. I think their recommendations, their guidance is pretty good. So you'll see based on this, it's not a straight line, but we're about 7 days into this down slope. And that means another 7 to 10 days, I think we can start making some announcements about places that we can go and places that can be opened. With that, Max, I'm happy to take any questions. And again, Brian and Deirdre are here as well as Paul and Josh.
We'll start with the Connecticut Mirror.
Governor, today, Dr. Kumar at Hartford Healthcare talked about preparing people for a long haul regarding social distancing. So can you put into context what people should expect over the summer and fall as you ease these restrictions if these numbers indeed hold up?
Well, this is why I have a task force of business and scientific folks who are looking at this every day. My estimation is we're going to open up those things which you can do safely, those things where you can social distance. Maybe that's going to be, the rest. We didn't close most of our retail. We didn't close much of it at all, except for the fact that a lot of it we made for pickups. So maybe we'll find over time those pickup places you can go in as long as you have a mask and the appropriate social distancing. As you know, when it came to manufacturing, it came to big outdoor construction, we never changed that. As you move on into the summer, obviously, with warmer weather, maybe you'll find that restaurants, outdoor eating is something that we can find we can do relatively safely, but perhaps an indoor crowded bar is something we can't figure out how to do safely in the near term. And one of the things the task force is doing, Paz, is they were asking all the folks in industry, what are their best ideas in terms of how they can provide services safely? That gives you an idea, I think, of how you start, moving into the summer, and we slowly get back to a new normal.
People are going to jump on your phrasing there of what might happen in 7 to 10 days. So I want to ask, the hospitalization trend is clear enough to follow, but when you look at the CDC guidelines about trajectories of caseloads, it's a little fuzzier, at least to me. So what is it that Connecticut is looking for in caseloads? Is it the slowing of the rate of new cases, or do you want to get to the point where anyway, let me just stop there. Yeah. What is it on the rate of new cases that will be the indicator that will tell Connecticut you can ease up on some of these restrictions?
I'm going to start and then hand it over to Josh. But remember, number of people diagnosed as infected is a direct correlation to how much testing you're doing. And we're having our discussions right now about, do you test folks who are showing symptoms? Do you test folks who are non-symptomatic, although they're likely to be able to still infect people? At least 40% of the folks out there aren't showing symptoms, but are infectious at this point. Part of what New York did with the antibody testing was trying to get an idea of what the overall level of infections might be in New York compared to Syracuse. And as you can imagine, found an enormous difference. I still tend to look at hospitalizations for me right now as a key metric. I think that trend line makes sense. I think it's a barometer a little bit for what's going on in the greater marketplace until we can do more aggressive testing. And I think Josh will tell you we're going to be ramping up our testing big time.
Yeah, that's right. And I think the governor said it perfectly. I mean, the hospitalization rate is, and the hospital census of COVID patients is really the key metric, because it's a statement of both the declining rate of infection and hospitalization, but it's also obviously a key indicator of the capacity of our hospitals to both get back to business, dealing with a lot of other procedures that have been put on hold that are critical. A statement on their PPE supplies and their confidence around that, and the ability to respond to any hotspots that could pop up in the future.
So when it comes to new cases, so over the last 4 days, it looks like an average of 700 new cases. Are you looking for that average to come down, or are you discounting that because as you increase testing, you're also going to increase positives, presumably?
Yeah, it's more the latter, because as we've pointed out previously, and Dr. Carter and others have, that the testing is really probably the tip of the iceberg. And some of the studies that are being done on antibody testing now, like in New York, has released some data, preliminary data, that shows that to be true. So I think the more we ramp up testing, the more there may be positives coming in as well, even if the overall actual infections out in the community is going down at the same time.
Thank you.
Move along next to Channel 3 Eyewitness News.
Yes, talking about the food shortages, specifically in Connecticut, is there a type of food that we're going to be seeing a shortage of? And when is the expectation that the shortages will be seen in the grocery stores?
You want to take that, Brian? You heard the question about where do you think we might see some shortages?
Well, and thank you for that. And Tyson Foods and their advertisement this weekend on the proteins, the meat sides, have said that, given that they're shutting down plants as COVID-related illnesses pop up, I think you'll see it in the meat sectors. But USDA is also working closely with the industry on the national level, and they continue to send out messages that people should not plan on experiencing food shortages. So it'll be interesting to see where that actually that gap comes. But there will be less food processed as processing plants are quarantined for 2 weeks.
And then, Ms. Giffords, really briefly on the SNAP allotments, they've been increased to the maximum amount. Is that for everybody? And what is the maximum amount on the SNAP?
I wish there was a straightforward answer to your question about what's the maximum amount, but the answer is that it depends on a lot of different things, including the family size and structure. I think you could think about a range of around $350, but again, it's very variable. But yes, we did receive a waiver from the USDA to increase every family to the maximum amount for their family size and their particular family structure. So every family in April received that maximum, and they will do so again in May.
Thank you.
You're welcome.
Waterbury Republican American.
Thank you, Max. I guess this probably would be a question first for Josh. I happen to have had a chance to read through some bidding documents today regarding testing services that you're seeking an RFP for. And in the frequently asked questions, there's two references, to a member of the state task force, a subcommittee on testing, talking about needing 10,000 tests a day. The DAS response doesn't dispute that person says it, but says that a volume hasn't been decided yet. So can you perhaps put that number in some context for me?
Sure. You were breaking up there a little bit. The question is the number of tests per day? we're targeting?
Yes, there's a bidding. Yeah, there's a bidding document that basically references a discussion, I guess, during some sort of bidders conference where a member of the state task force was saying 10,000.
Yeah, I got it. So as part of the Reopen CT plan, we're working on a strategy for how we ramp up testing over time and how we build out the groups of people that are able to be tested. The governor mentioned a moment ago about moving from basically what we're doing now is just testing symptomatic people and even a subset of them to moving into asymptomatic folks, and how you prioritize that testing scale up in a way that most minimizes the public health risk while as we start to reopen the economy. So we're working through that, and over time that number will grow. And so what we're out now is soliciting input from people who want to be part of our efforts in the state of Connecticut to scale that up. We've now received 12 responses, and we're working through those with our Department of Public Health team and the procurement team at DAS to start making announcements around that, as the governor mentioned, hopefully by the end of the week.
But are you going to need 10,000 tests a day? Somebody mentioned that. I don't understand whether that was just an example thrown out there saying, oh, well, we may need 10,000 tests a day, or if that's a figure that's under consideration.
Yeah, we'll have more to share about that, as I mentioned, probably by the end of the week.
Okay, and then the Commissioner Gift, you said the EBT in something about May, maybe SNAP recipients will be able to order groceries online?
Yes, that's correct. We don't, just to be clear, we don't have approval yet for that. We're working with our partners at the USDA and Food and Nutrition Service, and we're also working with our vendors and the online delivery services that will need to work with us. But we are anticipating being able to do this by the end of May.
And Governor, real quick, just you said in a week to 10 days you'll be able to make some sort of decisions regarding openings?
Yeah, very preliminary decisions, but yes, we're going to have more information at that point. And Paul, that's if we can maintain this declining hospitalization rate, that's the 2-week window that gives us at least some flexibilities for some early decision making there.
Okay, thanks very much.
Move along next to NBC Connecticut.
Yes, hi, Governor. Some parents are proposing a volunteer-run graduation ceremony on the same day at each high school athletic field across the state. They're asking basically for 1 day, a 5-hour reprieve from group gatherings. Your thoughts on that?
I haven't heard about that. It seems like an interesting idea. We frown on big mass gatherings, but you described something that may be an ingenious way to allow some young people to have a nice end to their senior year of high school. So let me think about that.
And talking about having control over our own food supply, are we working with other states in our region on this as well, maybe sharing resources?
That's a really good question. I don't know whether, Brian, you were on that. It has not come up in any of our regional governors' discussions yet, in part, I think, because we all tend to make more or less the same thing. Brian, did you hear that question?
Yeah, we are, and there's an ongoing commitment, food institutions for New England, about how to increase food production and capacity. This has, been going on for about a decade and will continue going on for many more years. So those conversations are taking place, not necessarily COVID related, but they would certainly benefit the pandemic we're in.
And regarding about the 7 days into that downslope of hospitalizations, and if there's another 7 days, may start looking into some easing of restrictions. Can you talk a little bit about any specifics that you would think about as far as flexibilities? I know that would be well before the May 20th date of when the Reopen Connecticut plan would come out.
Let me wait and let the task force. They're going to be here on Thursday. They're going to run those numbers. They're going to see what the risk benefit is, and I think they'll have some specific ideas.
Okay, thank you.
The Day of New London. The Associated Press.
Good afternoon, Governor.
Hey, Sue.
I'm not sure if you addressed this already, but I understand on the call today with the president, it was suggested that states for testing, I'm bringing that up again, that at least 2.6% of the population each month be tested. And I also understand that the president had suggested that some states move to reopen their schools before the end of the academic year. Are either of those two things feasible, do you think, in Connecticut?
They were certainly talking about the idea of providing us the reagents, swabs, and everything we need to test at least 2% of our people, on a daily basis. And that was, I thought that was welcome news. Seeing is believing, so, but that was helpful. You're right. The president did suggest, look, in different parts of the country, maybe you can think about schools in different ways. And one of the governors said, we're opening our schools, but just for private meetings and one-on-one meetings with teachers. So everybody is coming up with different ways that we can continue to, educate our kids. But as you know, right now, our online education is doing very well. The vast majority of kids taking advantage of it. We have the bilingual, reading materials coming from Scholastic being outlined. So I think we've got our options covered.
Are those testing goals, though, are they realistic for Connecticut?
Oh, in terms of that 2% number?
Yeah, right.
I think it depends what time horizon you're looking at. I mean, I think with enough time, certainly. And then the question is how quickly can we get there?
And one last question. I wondered if you're getting a lot of pressure from tourist attractions, summer events, people that are trying to plan for the summer. What do you tell them, and who will ultimately make those decisions? Will that be the state, or will some of those decisions be made on a localized basis of what opens, what doesn't this summer?
Well, again, the task force will give us the best ideas in terms of big events. Let's say we had one on Saturday. We had pretty warm weather, and our beaches were busy, and our parks were busy. And Katie Dykes, our commissioner, had to cut off parking at those locations. I think Hammonasset and Sherwood Island down in Westport, each at about midday, 1 o'clock in the afternoon. So we're going to be fairly strict on a statewide basis in terms of how we do events like that. But as you know, we never closed those facilities down, and I'm pleased that Rhode Island, I believe New York, are going to be opening up their beaches and parks, and that may take a little bit of pressure off of us.
But you've got other tourist attractions too. I mean, you have not besides beaches. There's the aquarium, the casinos. Are you getting a lot of pressure to try to get those reopened?
I wouldn't say pressure, Sue, but people are looking for clarity. They said, what are you thinking when it comes to the aquarium? And if I can come up with a strategy, Governor, where I can keep people socially distanced, we can limit the number of people coming in, would you allow us to think about reopening? And the answer to that is yes. We're getting the best ideas from the people who are absolutely impacted by that.
Okay, thank you, sir.
Fox 61. Fox 61.
Hi, Governor Zania Maldonado. Everyone relies on grocery stores for food, and a lot of people are finding empty shelves, like you said, Commissioner, in the meat department and dairy. You mentioned working with grocery stores to make sure they are well maintained. Could you talk about those plans?
Well, I'll start and then let me hand it to Brian. But grocery stores have been and always are essential businesses for us. And we have set pretty clear guidelines in terms of how they stay open and grow, in terms of masks, in terms of social distancing, in terms of 6 feet at the cash register and the such. And we're going to do everything we can to make sure everybody working at those grocery stores are treated like first responders. And, Paul will tell you that we just opened up our subsidized daycare for each and every one of those workers just in the last, week or so, just reminding people that we really, treasure their service. Brian, there were some questions about shelves and things that maybe aren't there.
Yeah, we've been through the Emergency Operations Center. The ESF6 has been a food working group that's been ongoing. And the Connecticut Food Association, of which the grocery stores are members, participate in that. They have been saying that there will be, limited brands, but not necessarily limited supplies of different groceries and goods. The other component to acknowledge here is the ability for farmers markets, especially in our urban areas, farm stands and farms, to fill some of that gap. And we're seeing a tremendous demand for locally grown products across the state. People are returning to their communities and supporting these local businesses, which has been great. And to that effect, we created, in conjunction with Connecticut NOFA, the ConnecticutGrownMap.com for consumers to look and find their local farm or farm stand or farmer's market to purchase goods.
I love that idea, Brian. I mean, the farmers markets are outdoors, so it's obviously the safest type of shopping, and it supports our local farmers and gets you good, fresh food. And SNAP will pay for it, so I love it.
And then, Governor, you signed an executive order that school district employees, including bus drivers, would continue to be paid during this pandemic. But a number of drivers are reaching out to us, telling us they're still not getting paid. School districts are not paying the private bus companies. Therefore, they're not getting paid. Who's to be held accountable in this situation?
Is that a municipal decision?
Paul Mounds, Chief of Staff, Governor's Office. Well, our office provided direct guidance to all municipalities about how to interpret that executive order. The purpose of that executive order that the governor put forth was to ensure that those individuals, those employees would be paid during this epidemic, especially since the state has provided and made sure that educational funding has been provided to those municipalities. We'll be happy to follow up directly to ensure that those individuals are paid thoroughly through this crisis.
Move along next to the Hartford Current.
Thank you, Max. Governor, your reopening task force is obviously doing some very important and very detailed work. Do you have any concerns at all that the task force is not subject to FOI and that their meetings are not open to the public?
Well, they are going about 14 hours a day, online, real-time Zoom. Josh and I were on with them for 3 hours on Sunday morning. But more to the point, I'm going to have them here taking questions from you and any other folks that on every Thursday. So you know exactly what they're deciding, why they're deciding. I'm making decisions, but what recommendations they make. So you know exactly what we're thinking about and how we came up with that.
Okay, also, can you tell us about the CDC being in Connecticut for the nursing homes, and also what exactly will the National Guard be doing in the nursing homes?
Sure. So the CDC, as I understand it, has deployed some of their folks to all states to help out, recognizing that nursing homes are an area of significant risk in this pandemic. More significantly, though, as we discussed previously, we have 40 staff in our Department of Public Health who have been doing on-site inspections of nursing homes and increasingly assisted living facilities as well. And then we've augmented, we are in the process of augmenting that team with another roughly 30 members of the Connecticut National Guard who have been trained up to support that work, people who in their day jobs are EMTs or nurses, or in some cases sanitarians who are going to be complementing that work so that we can do even more detailed reviews and potentially more frequently. So we've got a lot of people pulling together to help provide additional supports to our nursing homes and the staff on the front lines there.
Okay, so as you said, the CDC is literally going to all 50 states to keep an eyeball on nursing homes, if I heard you correctly?
My understanding was that they were deploying staff to many states, if not all.
Okay, thank you.
Move along next to CT News Junkie.
Thanks, guys. I wanted to know, Harvard and STAT came out with a study, and it said in order for Connecticut to open on May 1st, which I know isn't in the realm of possibilities, we would have to increase our testing by about 15,000 tests per day. Is that something that's possible or something that you guys are looking at or could even get the materials for?
Not in the near term, but we are ramping up as fast as we can. As you heard us mention, between Quest, between CVS, between Abbott, we have some great corporate relationships that are allowing us to ramp up our testing. 15,000 a day is going to take a little while, won't it?
It'll take a little longer than that, but I think the key point is that, what the governor has been talking about is not like just flick the switch and everything's open immediately. We're looking very carefully at the types of activities that have the greatest job and economic impact balanced against the lowest public health risk. So that's the balance that the team is really studying very carefully. And so as we look at those types of activities, the testing is going up at the same time, and we're looking at how we marry the two to get to the right outcome for the state of Connecticut.
And Governor, the state of New York canceled its presidential primary today. What are your thoughts on Connecticut's?
Well, we're still doing our primary in August. We're going to do it alongside the local primaries. We've got to do that, and I think that gives us enough time that we can plan for it. Gives us enough time to hopefully get on the backside of the worst of this pandemic, and we're going to find a way to make sure that anybody who wants to vote can vote safely.
WTIC 1080 News.
Hi, Mr. Governor. As you know, Saturday was a Chamber of Commerce type day, and all the parks were slammed according to state DEP. They said all the parking lots had to be closed. Any social distancing concerns from that? People want to get outside, and yet if there's so many people in a park, they might be too close together, I guess.
Well, we're being pretty strict about the parks, but I wanted to keep them open. I wanted to keep our beaches open. I want people to have a chance, if they do it in an appropriate way, to be able to go outside and enjoy the warm weather. And even if I said you can't do it, then everybody would jam someplace else in a sidewalk or something. I've talked to some of the mayors with traffic down by 50%. If you have a warm Saturday, maybe you want to close some of the roads in downtown New Haven or Hartford and make those available for pedestrians as well, so people can get outside safely and have some distance.
Speaking of roads, before things open and traffic comes back, can you get more crews maybe out early to start doing some of the infrastructure work you've been wanting to do since there's not a lot of cars out there?
Yeah, no, that's a really good question. Joe Giletti has pointed out that we're able to repair that road, state of good repair, in 30% less time at 30% less cost, in part because you can, close down a lane where before that would create a real traffic congestion. The inverse of that, I hate to tell you, is that with the collapse in energy prices, there's also a collapse in the amount of gas tax revenues we go to help pay for our transportation. So we're making do with what we got.
News 8. News 8. Hearst, Connecticut Media.
Thanks, Max. Hi, Governor.
Again.
Hey, Paul. So, how much of the reopening council meetings are going to be open to the public? It sounds like our only look at it is going to be on Thursdays in the older Probst room.
Well, I'll say this, as the governor said, that we do a press conference every day where we're able to answer questions directly about the daily activities. The one thing that we'll also announce today is that we're going to be launching a website, reopenct.ct.gov, that will be launched later this week, where you can provide direct input into the Reopen CT subcommittees and the teams. In addition, like I said, we're going to make sure that this is a process that involves all of Connecticut. And so that website will provide that opportunity every day. The governor, along with various members of his team and his cabinet, are here to answer questions directly. And we're just going to make sure that we're going to be responsive to the people of Connecticut, to legislators, and anyone else as well.
And Josh, do you have any data on cases and or deaths in assisted living facilities at this point?
We're working on pulling that together, and we hope to be able to release that for the first time in our large data package on Thursday.
And the last question, Governor, the Connecticut Conference of Municipalities is joined a coalition to try to get more federal money for towns and cities, and it sounds like they're available for any money that you want to give them. Have you contemplated this notion?
Well, I certainly welcome them, putting their might behind lobbying to make sure that the states and localities get some federal support, because right now the feds pay us back for any out-of-pocket COVID-related expenses, but the other 90% of our shortfall, and I think you're going to find in our municipalities as well, is related to a loss of revenue. And as I mentioned when it came to North Dakota and Wyoming, Mitch McConnell would have you believe these are just profligate blue states, and they shouldn't reward their indolence. But you're going to find that a lot of states are impacted in different ways. For example, those that have a lot of energy have been impacted even more dramatically than we have. Look, with that, I think we've exhausted all your questions for one day. I want to thank Deirdre and Brian, so much. And look, a little help from the dairy farmers. Those in Litchfield County, those are already beginning to, donate milk. And they get to our food pantries. They're getting to a food bank. They're getting the food share. And they're making everybody's life just a little bit easier during a tough time. Thank you, everybody.